Have you noticed someone you love, perhaps a parent, a grandparent, or a dear family friend, start to show little changes over the past year that make you feel uneasy? A lot of us tend to imagine that when an older person passes away, it happens quickly, almost without warning. However, that's usually not how it goes. In many cases, the body begins sending subtle signals months or even a year before life draws to a close. The problem is, these signals can be so gentle or gradual that most people don't recognize them for what they really are. It's only later, when they look back, that they recall the minor hints, the small shifts that pointed toward a deeper decline. At that point, it's too late to have prepared emotionally or practically. It's too late to seize the chance to spend truly meaningful moments together. But by becoming aware of these signs now, you can step in early, offer better care, and ensure your loved one's final stage of life is filled with comfort and dignity, rather than frantic stress or regret. One common early sign that many people miss is significant weight loss that seems to happen out of nowhere. Maybe you've noticed that an older relative's clothes look a bit baggy, or their belts suddenly need a tighter notch. When asked, they might say they're just not hungry or that food doesn't taste good anymore. At first, it might seem like normal aging, but unintended weight loss can be your first red flag. Our bodies naturally change as we get older, but when weight keeps dropping despite efforts to eat well or add nutritious drinks to meals, it often means the body isn't absorbing nutrients as it should. Muscle mass diminishes, energy dips, and the immune system can suffer. Someone who's been stable for years might begin falling more often or feeling more tired than usual. And while you might try offering them favorite treats or cooking their beloved meals, if the pounds keep slipping away, it's not just a matter of taste or appetite. It's the body's larger transition towards shutting down. Knowing this can help families understand that, at some point, forcing big meals may cause more discomfort than benefit. Instead, providing small, easy-to-digest foods and ensuring plenty of hydration can be the kindest approach. Have you also noticed your loved one is sleeping more or finding everyday tasks overwhelmingly tiring? Another frequent change is deep, ongoing fatigue that can't be shaken off with a nap or a good night's sleep. Suddenly, even walking across a room can be exhausting. Sitting up in bed may become a challenge. Activities they used to do every day, like cooking their own meals or chatting on the phone, become too draining. This kind of fatigue isn't just getting older, it's the body reserving what little energy it has for the essentials. Hearts grow weaker, oxygen doesn't circulate as efficiently, and muscles may not respond like they used to. When you see someone who once prided themselves on being independent struggle to stand or move around, it's heartbreaking. But pushing them to just try harder won't help. It may actually increase the sense of frustration and embarrassment they already feel. A more compassionate approach is to allow them to rest when they need to, provide support when they do feel like moving, and encourage any level of gentle activity they can handle without distress. Emotional support is also key. As older folks get tired more easily, they might start withdrawing from social events or family get-togethers, not because they don't want to be there, but because it's simply too taxing. Recognizing that helps you respond with greater patience and understanding. Speaking of withdrawal, changes in mental clarity and social engagement are also common. Perhaps you've noticed someone repeating stories or forgetting names when they never used to. Maybe they get lost in a place they've known for years. Or they can't follow a TV show, even one they used to enjoy. These small slips often start months before more obvious signs of serious decline become evident. Sometimes people will have moments of perfect lucidity, only to suddenly seem distant or disoriented. This can be puzzling for families and friends who can't figure out why the person seems fine one day and out of it the next. But as blood flow slows and the brain receives fewer nutrients, these fluctuations become increasingly common. Along with forgetfulness, there's also a possibility of a personality shift. You might see someone become uncharacteristically anxious, irritable, or impatient. Others might grow quieter than ever, losing interest in activities that once brought them joy. They might stop calling loved ones or refrain from going out at all. It's not because they suddenly don't care. It's often because interacting takes a lot of mental and emotional energy that they just don't have. For family members, this can be devastating. It might feel like you're losing the person before they're physically gone. But recognizing that these emotional and cognitive changes aren't within their control can guide you in choosing calmer ways of communication. Sitting with them, speaking gently, or even just offering a hand to hold can help them feel secure and less isolated. The body's capacity to fight off sickness also starts to wane. Maybe you've noticed your loved one seems to come down with a cold every time there's a change of season, or a small cut on their hand takes ages to heal. The immune system weakens as the final stage of life approaches, which means infections become more frequent and more serious. Where a simple bruise might once have healed quickly, now it lingers. Pneumonia and urinary tract infections can pop up more regularly, and treatments that once worked wonders might not be as effective. It's not unusual to feel frustrated or worried when repeated infections occur, and it's natural to want to bring out stronger medications or hospital visits. But sometimes these more aggressive treatments only make a person's last months more stressful. Infections can also appear in subtle ways. You might notice a loved one growing more confused or fatigued rather than spiking a fever. Early recognition can be crucial for comfort. Instead of merely fighting these illnesses with every medical intervention possible, a focus on gentle care, keeping them clean, hydrated, and as comfortable as can be, might become the kinder, more realistic path. This doesn't mean giving up. It's about caring in a way that honors both the body's limits and the individual's dignity. On top of that, changes in breathing and circulation can become quite noticeable. Maybe you've watched your loved one breathe in a slow, shallow pattern where you've seen them pause for a couple of seconds between breaths, then resume normally. Sometimes you'll witness breathing that speeds up and then slows down again, almost like a rhythm that comes and goes. These shifts may be among the most alarming signs to observe, simply because breathing is such a basic life function. Yet for someone nearing the end of life, it's often a way the body starts to conserve energy. The heart isn't pumping as strongly, and circulation might be redirected to vital organs. Hands, feet, or ears might feel colder or appear a bit pale or bluish. You might also notice shortness of breath after minor movements, such as adjusting a pillow or sitting up. It can be painful to watch, and the impulse is often to urge deeper breaths or to panic about what's happening. But in many cases, these changes are the natural progression of the body. While supplemental oxygen or certain medications might offer some relief, the ultimate goal is comfort rather than fixing something that's part of a natural, irreversible process. All these signs, weight loss, fatigue, confusion, infections, and shifting breathing patterns, tend to emerge gradually, often months before life ends. They may not all happen at once, and some may be more obvious than others. The most important takeaway is that seeing these signals doesn't have to mean panic. Instead, it can be a call to refocus, to spend quality time, provide emotional support, and ask your loved one how they're truly feeling. It might be a chance to get certain affairs in order, have conversations you've been putting off, or just sit quietly and share stories from the past. In our culture, we often avoid talking about death because it feels grim or frightening. But acknowledging these early signs can give families an opportunity to prepare, both logistically and emotionally. It means less confusion or fighting for last-minute decisions and more space for closeness and meaningful connections. If you've noticed any of these subtle changes, consider reaching out for support. Talk with healthcare providers who specialize in palliative care, even if it seems too early. They're experts at helping families manage physical and emotional symptoms, and their goal is to improve quality of life when a cure isn't possible or when aggressive treatments wouldn't really help. You might also seek spiritual or counseling support if your loved one or your family values that. Planning for end-of-life care doesn't hasten death. It actually allows your loved one to live on their own terms and focus on what matters to them in their final months or weeks. You might be surprised at how much relief and peace of mind this kind of open communication can bring to everyone involved. It's crucial to remember that these changes are part of a natural process. Aging bodies don't shut down overnight. They gradually wind down, often giving us chances, if we notice them, to step up and offer a steady presence or a comforting hand. None of this is easy. The emotional weight can be heavy. You might feel grief or denial and swing between wanting to keep hope alive and wanting to be prepared. That's completely normal. But having this knowledge can help you navigate these difficult emotions. It also reminds you that you can still create cherished moments, even when someone is no longer at full strength. Maybe it's flipping through photo albums and talking about a shared vacation from decades ago, or maybe it's just sitting by their side while they rest so they know they're not alone. For many families, the biggest challenge is letting go of the idea that you can fix these changes. When someone you love has been a pillar of strength or wisdom for so long, it's tough to accept that their body is telling them it's time to rest. The best care doesn't always mean trying to force things back to normal. Sometimes it means embracing the new normal with grace. By recognizing the signs early, things like significant weight loss, unshakable exhaustion, forgetfulness, repeated infections, and notable shifts in breathing, you can shift your energy from denial to compassion. You can choose to spend those months, weeks, or days providing comfort and emotional closeness, which is often what truly matters to the person going through this transition. If you find this information useful and are still here reading, take a moment to reflect on what speaks to you the most. Maybe it's the insight about weight loss being more serious than it first appears. Maybe it's the reminder that confusion or withdrawal is usually out of the person's control. Or perhaps it's the realization that repeated infections might hint the body simply can't recover like it used to. Whatever stands out to you, let that be your guide in the conversations and decisions you make moving forward. Don't be afraid to ask medical professionals questions or to reach out to others who've gone through similar experiences. Sharing stories can be an incredible source of comfort and knowledge. Also, if you feel moved to do so, you might share what you've learned with someone else going through a similar situation. They might be brushing aside the fact that their mother rarely finishes a meal or that their grandparent is sleeping almost around the clock. Sometimes people just need a gentle nudge to notice a pattern that's been in front of them all along. And if you'd like to stay connected with more conversations that tackle these intimate, challenging parts of life, you can find communities, both local support groups and online spaces, where people share experiences and advice. That sense of shared understanding can be healing. Above all, remember that witnessing these changes doesn't have to rob you of your final opportunities for closeness. In fact, recognizing them can strengthen the bond between you and your loved one. You can make deliberate choices, maybe choosing a quiet evening at home instead of a big family party, if that would suit their energy level better. Or perhaps you set aside time each day for a short phone call or video chat if you're physically distant. In these conversations, you don't always need big speeches or detailed plans. Sometimes just saying, "I love you," and "I'm here," is enough to convey the depth of your care. These small gestures can offer real comfort to someone who's feeling the full weight of these physical changes. When the time does come for them to transition, having had these moments of connection can alleviate some of the painful regrets people often experience. Instead of saying, "I wish I had known," or "I wish we had done this or that," you can find solace in the fact that you were present, that you recognized the signals, and that you honored the time you had left together. It doesn't erase the pain of loss, but it can soften it. It can give you memories of love, gentleness, and understanding, rather than frantic last-minute scrambling or denial. Thank you for taking the time to learn about these important, yet often overlooked signs. This is delicate territory, and I appreciate your willingness to stay with this topic. If you've gained something from this, it might mean you're more prepared to handle the changes in your loved one's health with grace and empathy. Perhaps you'll sit down with your family or close friends and calmly talk about how best to support your loved one when you see these indicators of decline. Knowledge is a powerful tool, one that lets you plan instead of panic, cherish instead of ignore, and love instead of fear. Feel free to share your reflections or experiences if you're comfortable doing so. Every family situation is unique, but many emotional threads connect all of us facing the reality that those we love won't always be here in the same form. Remember, you are not alone. There are so many people walking a path similar to yours, and each shared story can bring a bit more clarity and courage to the journey. If you find value in discussions like this, there are resources like hospice care guides, palliative care specialists, and online forums where you can discover more practical tips and emotional support. Above all, keep in mind that these final months or weeks can still hold precious, meaningful memories. Even if conversations become quieter, even if outings become simpler, the depth of love and understanding you offer is what truly counts.